Hi, everyone. A very good evening to you. Thank you for taking the time to be with us tonight for tonight's Health Talk. My name is Beth, and I'm one of the care leaders here at 365 Cancer Prevention Society. I will be your host for tonight. Okay, but before tonight's talk begin proper, I'll just share today's itinerary first. We'll begin with the main talk by Dr. Lim to share with us more about gynecologic cancer. And then we'll end today's session by having a Q&A open to the floor. All right, so throughout the talk, please note down your question, and then you can ask them later when we open the floor and by typing it into the comment box at Facebook. And after that, we'll do a closing where I'll be sharing more about next month's Facebook Live event as well. Okay, so I'll be sharing on the screen our social media pages. So please like and share our event as well, because it is organized by 365 Cancer Prevention Society and our co-organizer, NCIS. And I would like to share about today's disclaimer as well. So please kindly note that all information shared at this event by the speaker and 365 Cancer Prevention Society are for general information only and subjected to changes. Do consult your doctor for personalized and detailed medical advice. Thank you. Okay, so now, without further ado, I'd like to do a little introductions on today's speaker. We are very pleased and honored to have with us today Dr. Lim Limin. She's the Associate Consultant in the Division of Gynaecologic Oncology in the National University of Cancer Institute, Singapore. So now we'll welcome Dr. Lim onto the show.
Hi, good evening. Hello, Beth.
Hey, hi, Dr. Lim.
Hi, thanks for the kind introduction. Really very happy to be here tonight to share more about screening and prevention of female reproductive organ cancers. So I will start off by sharing my screen. I have a presentation prepared for tonight. Right, so just a brief introduction of what we will be covering today. So I'll be talking mainly about prevention of cancer in the gynecological organs, which are basically female reproductive organs. So basically, the three main gynecological organs in our body would include the uterus, or what we call the womb, the cervix, and the ovaries. Just a brief introduction on what these three organs are and where they're located. So basically in the female patient, there will be the organs that's located in the lower part, in the pelvic region over here. And where we talk about the uterus, it's actually the womb, where the pregnancy is usually located and where menstrual blood will originate, and it flows out this way through the vagina. So the cervix, or what we call the neck of the womb, which is the lower part of the womb over here, is where the lower part of the uterus allowing passage of menstrual blood through. So we consider these as two separate organs. And the third organ would be the ovary, which is the site of ovulation, where eggs are being released every month, and also where the female hormones are being produced. So just to highlight why we are having this talk, if you can see here, this actually shows the top 10 most frequent cancers and cancer death in Singaporean females in recent 5 years. So on the left, you can see the top 10 female cancers, and the three gynecological organ cancers are actually right in top 10 here, with the uterus or the womb cancer being 7.2% at the 4th place, and the ovarian cancer in 5th, and cervical cancer in the 10th place. And in terms of cancer deaths, ovarian cancers has been shown also to be at number 7th, and the uterus at 9th and cervix at 10th. So this highlights that they are really very prevalent in the female population, which is why we would like to focus on how we can prevent, and also early detection would be recommended as well. So we will focus most of our time actually on cervical cancer, which is actually the out of the three, the only one where there is a proper screening program, and a screening program that has been shown to have reduced mortality or death rates among female population. So as we all know from the chart previously, it is the 10th most common cancer in Singaporean women, and there are about just over 1,000 that's diagnosed over a 5-year period. And Malay women are generally at higher risk than Chinese and Indian women. So if you can see here, the incidence have reduced over the past 3 or 4 decades, between 1976 to 2015, and this is the result of cervical cancer screening, or what we call Pap smear. I'm sure that is a familiar term to most of you. So, but despite that, there's still much more that needs to be done, because we still see it being in the top 10 cancers. So this is why I would like to talk to you a bit more to highlight to you the necessity for screening and also prevention with vaccinations. So in general, the age group that cervical cancer affects are the age group that is generally between 40 to 60s age group. So when we talk about cervical cancer, there are 2 main types. So the first type is that which grows on the skin that is lining the cervix. And there's the second type that grows from the lining of the glands of the cervix within the canal. So if you can see here, the portion on the outside is where what we call the first type, where the skin lining the cervix. And most of the glands are within what we call the endocervical canal. And this is where the second type of cervical cancer arises from, both of which are associated with a viral infection called human papilloma virus, or HPV in short. I think this is a term that is familiar to some of you, because there has been talked about in the media. Basically, I want to highlight that this is actually a common viral infection, but truly only a minority of infected women actually develop pre-cancer or cancer resulting from HPV, because with good immunity, which most of us have, they actually tend to clear the virus within 1 to 2 years. So essentially, for cervical cancer, prevention and early diagnosis is key. First, there's basically 4-pronged approach to this. So firstly, to reduce the risk factors associated with cervical cancer, screening, vaccination, and also to watch for symptoms. And when I talk about the 4th point, it's more of early detection, because when I talk about symptoms, it's more of a cervical cancer. So risk factors for cervical cancer include smoking. So smoking actually depresses our immunity and makes it harder for us to clear the HPV virus. Hence, it causes them to persist and lead to pre-cancers and cancers. Multiple sexual partners, onset of sexual intercourse at an early age, history of sexually transmitted infections, and decreased immunity, for example, in women who are on immunosuppressive drugs, or if they are organ transplant patients such as kidney transplant or liver transplant, the medications can decrease their immunity. In terms of cervical cancer screening, the cells are actually taken from the surface of the cervix. And in general, there is 2 types of screening. Pap smear is one that has been there for decades, and what has actually caused the incidence of cervical cancer to come down. But there's still much more that needs to be done. Basically what it does is to look for precancerous cell changes. It's 3 yearly intervals, and it is recommended in women between 25 to 69 years old, available in all polyclinics and tertiary hospitals. But this is all basically prior to 2019. Now, since 2019 April, we have rolled out HPV screening, which has been shown to be more efficient in terms of picking up precancer cells. Basically, it looks for the presence of the virus. Because it's more accurate, it can be done at 5-yearly interval between 30 to 69 years old. It's more accurate, slightly more expensive. And at the moment, not only is it available in tertiary hospitals, it's also available in polyclinics. So at the moment, the new recommendation is that for women between 25 to 29 years old, they do pap smear, and 30 to 69 years old, HPV screening is actually recommended. And that is available in all polyclinics and tertiary hospitals as well. So what happens when you have abnormal screening test results, whether in terms of pap smear or HPV test? You will be referred to tertiary hospitals for colposcopy. This is a procedure where a microscope is used to look at the surface of the cervix, and various solutions are used to light up any abnormal changes, and the abnormal changes would then be identified, and a small amount of tissue or biopsy will be taken to confirm the abnormalities. So this is the microscope here, or what we call the colposcope, taking a look into the cervix projected onto the monitor here. So then any abnormal areas that is highlighted by the solutions will be taken for a small biopsy. This is done so as to detect precancer cells, which can be removed to prevent cervical cancer formation in future. When we detect precancer cells, we can subsequently do treatment to clear the cervix of all precancer cells so that they don't progress to cancer in future. So I was talking about screening. Now I'm moving on to vaccinations, which is a very, very important role in preventing cervical cancer. So with vaccinations, especially in the younger population, it can prevent our girls, females, from having HPV virus infection in the first place, and hence not having any abnormal screening results at all in their future. So basically, these vaccinations can reduce the risk of precancer and cancer of the cervix, but it also can prevent that in other organs like vagina, anus, penis, because the HPV actually resides in the lower genital tract. So it actually covers all these different organs as well, and in the males as well, as you note here, the anus and penis. So it actually prevents future infections of HPV, which actually increases risk of cervical cancer by up to 400 times compared to someone who does not have any HPV infection. But what it does not do is that it does not treat current or persistent infections, which means that if you already have HPV 16 and you take the vaccination, it can prevent other strains of HPV but not HPV 16. So this is licensed to girls and boys between 9 to 26 years old. But in recent years, Gardasil 9, which is the latest and the widest coverage vaccination, has been approved to be given up to 45 years old in both males and females. And most effective if given before first sexual intercourse, because that is when the individual has not gotten any HPV virus infection yet. And at the moment, there are 3 types of vaccinations, which I'll be talking to you about. Something to take note of is that none of the vaccinations offer 100% coverage. So routine screening is still mandatory, like what I mentioned earlier. 25 to 29 years old should get pap smear, and 30 to 69 years old should get HPV test as part of cervical cancer screening. So these are the 3 types of vaccinations that's currently available. In the polyclinics, they have the Cervarix. In the tertiary hospitals, we have the Gardasil and Gardasil 9. So essentially, the Cervarix covers HPV 16 and 18, which are the 2 highest risk virus causing cervical cancer, 70% of them. So Gardasil 4 or Gardasil actually covers the same types plus genital warts. And Gardasil 9 covers the same as Gardasil plus 5 more high-risk types, essentially covering 90% of all cervical cancer plus genital warts. So Medisafe coverage is only up to 26 years old for the first 2 types, Cervarix and Gardasil 4. And Gardasil 9, it's currently still not covered by Medisave yet, costs about $600+ for 3 doses. So the side effects are generally mild, such as pain, redness, headache, fever, dizziness, and it has been shown to be safe in worldwide studies as well. Lastly, it is important to watch for symptoms, particularly these are red flags that one should really see a doctor for, because we will be worried about cervical cancer. So one would be bleeding after sexual intercourse. This is the most prevalent symptom that we see, and other abnormal bleeding, such as abnormal bleeding in between normal periods, or what we call intermenstrual bleeding, bleeding after menopause, and any unpleasant vaginal discharge that needs to be seen, that will need to be seen by doctors as well, especially if the usual inserts or vaginal pessaries does not help get rid of. So when there's a suspicion of cervical cancer by a gynecologist, a small piece of tissue again will be taken from the cervix to confirm the diagnosis. And once the diagnosis is confirmed, the spread of the disease will then be assessed with detailed examination and body scans to determine what stage the cancer is at and whether there is any spread of the cancer to other parts of the body as well. Depending on the stage of the cancer, then there will be different treatment options tailored to the individual, including surgery, radiotherapy, or chemotherapy. So in summary, I just want to emphasize that prevention is better than cure. We do not want to wait till symptoms arise, which is the last point, before we detect the presence of cancer. We hope that we can prevent or reduce the rate of cervical cancer in the population with reducing of risk factors firstly, lifestyle measures such as smoking cessation, vaccinating our girls early, and regular cervical cancer screening. Bearing in mind that cervical cancer screening actually picks up pre-cancer instead of cancer, and it can actually treat the pre-cancer to prevent cancer from arising in future. And of course, early consult when symptoms arise so as to allow early detection of cancer so that treatment can be given accordingly. So right now, I'll move on to womb or uterine cancer. So as I illustrated earlier, uterine cancer is the 4th most common cancer in Singaporean women. 417 cases were diagnosed annually between 2010 to 2014, and it can arise from the lining of the uterus or the muscle. So the lining would be the dark pink area in between here, generally where the menses are, menstrual blood comes from, and the light pink area is the thick muscle layer surrounding it. So the cancer involving the lining is more common than that from the muscle layer. 70% of them actually occurs after 50 years of age, and basically, unlike cervical cancer, there is actually no effective screening methods available in the general population. So early consult is key. Basically, there are risk factors that we can take note of, and most importantly is to watch for symptoms so that there can be early detection available. So what symptoms are we talking about for womb cancer? So essentially bleeding after menopause or postmenopausal bleeding. For example, if you stop your menses and you start having bleeding again, please do not take it lightly. You should seek the doctor's consult when that happens. Bleeding in between menses, again, bleeding after sexual intercourse, abnormal vaginal discharge that does not go away despite the usual treatment, or pain in the lower tummy. So abnormal bleeding are common and usually not due to cancer, but it is important to have it checked out just to make sure that it is truly not due to something serious. So for risk factors of womb cancer, that's a little bit different from that for cervical cancer. So this will include obesity, women who have no previous pregnancies. In general, the cancer is actually related to the high amount of female hormone called estrogen that is circulating in the body, and that is actually associated with obesity. And also, the womb cancer is also associated with other conditions like high blood pressure, diabetes. As I mentioned, prolonged exposure to estrogen, such as medications. Family history or genetic conditions is one of the predisposing factors as well. There are certain genetic conditions called Lynch syndrome, which actually predispose one very strongly to womb cancer. And that is the situations where one should be wary of is when they have multiple family members with womb cancer or even bowel cancer, because that is what the two main cancers that are associated in Lynch syndrome. So the tamoxifen use, this is actually a medication that is used in breast cancer survivors to prevent recurrence of breast cancer. This has also been shown to increase the risk of womb cancer by 2 to 4 times. So we actually monitor these patients closely, and if they have any abnormal bleeding symptom, we will do sampling of the womb lining to make sure that there are no precancer or cancer changes. Some of the protective factors for womb cancer would include use of contraceptive pills and surgical removal of the womb. Usually this is done in women with known genetic conditions because they are highly predisposed to womb cancer. So some of them prophylactically actually remove the womb before they get any form of cancer. So management of uterine cancer, basically the diagnosis is made by taking a small tissue from the womb lining, or what we call a biopsy, as I mentioned earlier. So as you can see here, this is the womb, and this procedure can actually be done in the clinic setting, whereby a small tube is put through the vagina and the cervix into the lining, and then some scraping will be done. It will cause a bit of a crampiness, similar to menstrual cramps, and the cells are then drawn out with pressure, and that will be sent off to the lab to test for any cancer or precancer cells. This is hysteroscopy, which can be done in the clinic or in the day surgery setting. This is a camera, a rigid scope, if you can see here, that similarly goes through the vagina and the cervix and into the womb lining, where we can visualize the lining itself to see if there's any areas that look suspicious. And then sampling can be done either using this PPL sample or other instruments to get cells and send it off to the lab for testing as well. So once cancer is confirmed, the treatment can be by surgery alone, or sometimes surgery may need to be followed by radiotherapy or chemotherapy. And surgery can usually be performed either by open surgery, which means that there is an open cut to the tummy, or keyhole operations. There may be 2 types. So keyhole can be either using laparoscopy, a long instrument, or keyhole can be in the form of a robotic surgery, which is commonly done in our institution now as well. So in summary, uterine cancer is actually the most common gynae organ cancer. Unfortunately, there is no effective screening method available for the general population. So early diagnosis is key. Basically, be aware of your risk factors and to watch out for symptoms and to present early to the doctor. So now I'll move on to ovarian cancer. So ovarian cancer is, as we saw earlier, the 5th commonest cancer in female population in Singapore, and roughly 340 cases diagnosed yearly between 2010 to 2014. There are different types of ovarian cancer, some arising from the egg cells, some from the supporting cells, but most of them actually arise just from the surface of the ovary, which is what we call the epithelial cells. They usually affect older women, and same as womb cancer, there is actually no effective screening methods available. So again, early consult is key, to be aware of your risk factors and to watch for symptoms. So the symptoms are actually very non-specific, and they tend to present only when cancer has spread. The reason is because the ovaries are very small. Normal ovaries are generally only about 2 cm or even smaller in menopausal women. So when there is cancer cells or growth of cancer cells on the ovary causing the ovary to enlarge, it takes some time before we can actually feel the effect of it. It may grow because it will grow, and within the tummy, there's a lot of space around, so it allows it to grow without us knowing until the late stages. So there may be a wide range of symptoms that is possible, such as swelling and discomfort in the tummy, pain in the tummy, change in bowel habits, feeling of want to pass urine more urgently because of the large ovarian structure that is pressing on the bladder, decrease in your appetite or feeling full quickly again due to pressure effect or weight loss. So these are all quite non-specific signs. So if you have any of the above, and they are persistent, it is good to seek consult from your doctor as soon as possible. Some risk factors that are associated with ovarian cancer will include old age, early menstruation or late menopause, late pregnancy, or if you have never had children, family history of genetic conditions, similar to womb cancer, but a different condition, which is more likely associated with ovarian cancer, would be what we call the BRCA gene mutation. So they tend to have a stronger association with breast and ovarian cancer. And also estrogen hormone replacement therapy also increases risk of ovarian cancer as well. So some of the protective factors would include oral contraceptive pills, as well as tubal ligation or surgical removal of tubes. This is a form of birth control whereby clips are being applied to your fallopian tube to prevent pregnancy permanently through a small operation. Or if you, for whatever reason, had removal of the tubes, it is a protective factor as well, because it has been shown that the ovarian cancer tend to originate firstly from the tubes, which is just next to it. Or surgical removal of ovaries, and that's only usually done in women with genetic conditions, as I discussed earlier, such as BRCA or BRCA gene mutation. So in the management of ovarian cancer, firstly, the diagnosis is made from an ultrasound scan. So if you do have any of the symptoms that I discussed with you earlier, it is good to see a gynecologist. And then the ultrasound will usually be done to look for any growth in the ovary, because I mentioned sometimes they can be small and you don't, the symptoms can be quite non-specific. So they want to look for any growth in the cyst, as well as the second test, which is called a CA125. It is a tumor marker in the blood that tends to be raised in ovarian cancer. So if we are suspicious of ovarian cancer, detailed imaging will be done to look for spread of cancer, which is a CT scan. They will look for involvement of other organs in your tummy area as well. So operation or a biopsy at least is used to confirm whether the cells are cancerous or not. And treatment generally includes surgery, chemotherapy, or both. So in summary, for ovarian cancer, as mentioned, there is actually no effective screening methods available, and early consult is key, especially when you find any of the symptoms that I mentioned earlier, and to be aware if you have any risk factors associated with ovarian cancer. So coming to the conclusion slide, so it's important to be aware of what is surrounding these three cancers, so as to be able to reduce the incidence. So I think when we talk about screening, it is largely surrounding cervical cancer. Cervical cancer is actually the only cancer in males and females, basically, that has a vaccination available. So this is the only cancer where we can do what we call primary prevention. So this is why we are pushing very hard. Actually now, even in secondary school students, there are actually free cervical cancer vaccine being made available as well. So this is a strong push from the government in this direction as well. So besides vaccination and screening, same with uterine and ovarian cancer would be to try to reduce risk factors if possible and watch for symptoms and to seek a doctor's consult early. Okay, and for uterine and ovarian cancer, family history is important, as I mentioned, in terms of possible associated genetic conditions, and oral contraceptive pills are also protective. So I've come to the end of my presentation. I will hand over the time back over to Beth, and we can start off with the Q&A session after that.
All right. Hi, Dr. Lim. Thank you so much for the wonderful sharing. I hope our members have all benefit from it. Okay. So we'll now open up the floor to some Q&A. Also, if you have some questions that you may have during the talk, you may key them into the comment section at Facebook, and we'll try to get them answered. Okay, so I do have one question over here, Dr. Lim, if you can help me with it. All right. So if I am above 26 years old, I was wondering, can I still take the HPV vaccine?
So yes, in general, it is recommended between 9 to 26 years old for all 3 vaccines. But for Gardasil 9, which is the latest vaccine that is now available, it has been approved both in the United States and in Singapore as well to be given up to 45 years old for both males and females. So clearly we know that it helps prevent cervical cancer, but also in males because it also prevents anal cancer, penile cancer as well. So that's why now it is, and of course genital warts, not cancer, but it is a benign growth that can be quite disturbing to many and can be quite persistent. So that can be a disease that it is useful for as well. So hence the recommendation for both male and female up to 45 years old.
Okay, so thank you, Dr. Lim. So along the same line of this vaccine, we do have one question from our member, Chantal. So she was asking whether is it effective to take the vaccine at 45 years old?
Okay, so that's a good question. So the reason why the number 45 is stated is because most of the evidence of studies are within this group between 9 to 26, 27 to 45. So that doesn't exclude the possibility that this vaccine will be effective if you are, say, 45 and 7 years of age. So basically, it can still be effective, but we do not know the effectiveness that is associated with it. What I tend to say is that it possibly is still effective, but I would say that the effectiveness may be reduced compared to if you've taken it below 45 years old because of poorer immunity associated with age, and also possible if you are exposed to more viruses when you are older, then those viruses will not be prevented with the vaccine. Yeah, so the short answer is it can be taken, but one does not know the efficacy of the vaccine at the age, and it's slightly lower compared to the age group below 45 years old. Yeah.
Okay, thank you, Dr. Lim. All right, we have some questions from Sharon. So she has a 2-part question, so I'm just going to read them out. Okay, so she was asking if you could elaborate more on genetic factors for womb cancer. That's the first part of the question. All right, and is it necessary for a single woman to do pap smear to test for cancer?
Okay, so genetic factors for womb cancer, in general, when I believe you're talking about genetic conditions that predispose to womb cancer. So I think for the general population, it is important to the thing to take note of is if you have a strong family history of cancers. So it may not be just womb cancer, it may be bowel cancer, ovarian cancer as well, breast cancer, pancreatic cancer. So as long as there's a strong family history of cancer, not to say that you definitely have a genetic condition, but it is worthwhile seeking consult. There is a cancer genetics clinic that runs as well. So these actually help to identify if there is a possible genetic association in your family. But specific to womb cancer, what I mentioned was a condition called Lynch syndrome. It is a condition that predisposed to womb and bowel cancer mainly. And usually this is a very specific group of patients that we follow up closely. We do screening for this population. When I mentioned about no screening methods earlier, is for the general population. So for women with definite Lynch syndrome diagnosed, we do monitor them yearly with sampling and offer them preventive surgery to remove the womb as well. Yeah. So in regards to the second question, is it necessary for a single woman to do pap smear to test for cancer? So actually, cervical cancer screening, not just whether pap smear or HPV, is only necessary for women who have ever had sexual intercourse. So if it's a woman who never had sexual intercourse, there is no need to do cervical cancer screening. But of course, if you ever had even once in the 20 years ago, then yes, you will need to do cervical cancer screening. Yeah.
Okay, thank you, Dr. Lim and Sharon. Dr. Lim, I might need your help for the next question from Billing. There are some pronunciation that I might get wrong.
Yeah.
Okay.
Yeah. So I believe she's asking quite a specific question. So I think this, So I think it is a patient that had previous womb cancer. Went for total laparoscopic hysterectomy, vaginal salpingectomy, and ovaries conserved. So, they have stage 1, grade 1, stage 1A, grade 1. So, essentially, I think this is a question that I believe it is possibly a patient or someone that this lady knows directly. I would suggest this is a question that I should not be addressed in this setting, because to address the question of whether that was the chance of recurrence of cancer, it needs to we will need to look at the patient profile, the case, specific to the patient, the surgery that was done. So I think this is something that I would recommend to speak to the doctor involved, the gynecologist or the medical oncologist who is taking care of the patient, because there is no one answer fit all for such a case. So the doctor involved would then be able to advise accordingly. Yeah.
All right. Thank you, Dr. Lim. Billing, I hope we have answered your questions. Okay, so let's take one from the member Swan. All right, so she's asking, for girls who had earlier HPV vaccine when they were younger, do they need to retake the other vaccines?
Okay, that's also a good question. I presume you're asking that earlier she had a Cervarix or Gardasil, and now there's Gardasil 9, which covers 20% more cervical cancer coverage, and whether need to retake or not. Personally, we do not strongly recommend that one is to retake, because if you have the vaccination, whether Cervarix or Gardasil, it already covers 70%. So, and there's a cost to it as well in terms of taking Gardasil 9. So with a coverage of 70%, it is actually majority of the cervical cancer. And taking the Gardasil 9 does not also mean that you don't need screening in future as well. So weighing the cost-benefit ratio, in general, we will say that it is the patient's individual choice, but we do not strongly recommend or push someone to take the new vaccine per se. Rather, we will tell them that it's okay if you've taken one that covers 70% and not 90%. The most important thing still is to go for regular cervical cancer screening. I hope that answers your question.
All right, thank you, Dr. Lim. Okay, we do have one question on WhatsApp. It's from William. Although it's in Indonesia, we tried to Google translate it to to our best effort. Okay, so
Okay.
please forgive us if we translate it wrongly and the content got lost in translation. So basically, I am from Indonesia. Why cancer is called the silent killer, and does early stage cancer have symptoms? At what age and 1 year did you start health screening? And how many times and what did you do to get checked?
Sorry, I will address, sorry, the first question, sorry, there were a few, maybe we cover one question at a time.
Yep.
The first
Okay.
one was
So I think the first one is, does early stage cancer have symptoms?
cervical. I believe we are talking about
Correct.
cervical cancer. Yeah, okay. So early stage cervical cancer, the very, very earliest stage, may not have symptoms. We are talking about those that, because we do understand that it actually progresses from pre-cancer to cancer. So there are those that when they progress to cancer, in the very, very early stages, there may not be any symptom. And sometimes some women came in with abnormal screening result. And then after that, we find that she has no symptoms. And basically, we find that there is actually this very tiny microscopic cancers noted. So in the very early stage, they may not, which also explains the importance of screening as well. So when you have symptoms, they tend to be of a slightly more advanced stage, not the very, very earliest stage. Yeah. I think there are two more questions from him.
Yeah. Okay. I think the second part of the same question is, at what age did you start? Do we start health screening? I think this is what
Okay.
William is trying to get across.
Sure. So we start cervical cancer screening at 25 years old. Between 25 to 29 years old, we recommend the pap smear. And between 30 to 69 years old, we recommend doing the HPV test. So for pap smear, it will be 3 yearly and the HPV test will be 5 yearly. So 25 years old is the age if someone is sexually active. But if that person has never had sexual intercourse before, then at whatever age that she starts having sexual intercourse, then she should go for screening. Yeah.
All right. Thank you, Dr. Lim. And William, we hope that we have answered your question. All right. So there's a few other questions. Okay, let us move on. Okay, can we take HPV vaccine and COVID-19 vaccine at the same time? I think this is a very relevant question now.
Yeah, so that's a very, very common question in my clinic nowadays. So usually for COVID vaccine and any other vaccinations, they recommend an interval of 2 weeks. So whether you took whichever vaccine first, to keep a 2-week interval in between. Yeah.
Okay, thank you, Dr. Lim. So what happened if I miss my third dose of HPV vaccine twice? Am I still eligible to retake it?
Okay, good question. So in general, the recommendation from the product information leaflet is actually to complete the entire course within 1 year. So when we talk about vaccinations, usually it's taken at a 0 month point, then 1 or 2 months, and then 6 months will be the third dose. So if you have missed it, it can be taken up to 1 year, and that is shown that there is no reduction in efficiency. So meaning that you maybe missed it in June and then July again, then August can be no problem. Okay. Then there are some people that ask, but what if I missed it for more than 1 year already? So actually the CDC guidelines actually says that there is no maximum interval that one needs to consider retaking. So basically, as long as you complete it, whether it's more than 1 year, they say it's good to continue as well. So in short, if you've missed it, just try and take it as soon as possible. Yeah.
Okay, thank you, Dr. Lim. All right, we do have one question from Ling. All right, so for a woman who has a total hysterectomy, is pap smear still necessary?
Yeah, so no, it's no longer necessary on the basis that the woman had pap smear before that, and that was normal. And after they remove the womb, and so hysterectomy is an operation whereby the womb and the cervix is removed in total. Like total hysterectomy means the surgery actually removes the womb and cervix. So if the pap smear before that is normal, and after removal of the womb and cervix, the cervix came back to show normal cervix, no precancers, then the pap smear will not be necessary after the operation. Of course, if there are any abnormal changes in the cervix, then the doctor will advise otherwise accordingly.
All right, thank you, Dr. Lim. And Ling, we hope we've answered your question. Okay, another one from Sharon. All right, so generally, if a patient has endometrial stage 4 cancer, went for surgery, going for chemo and radiotherapy, so what does the patient need to do to prevent recurrence?
Okay, so this is again quite a specific scenario, but in general, what we recommend our patients would be to go for regular follow-up. There isn't exactly something, anything specific, something you do that actually prevent recurrence. For example, get a vaccination or take a particular medication apart from chemotherapy. Some people actually have, maintenance chemotherapy, but that's really up to the doctor. But I think the more important point here is to adhere to regular follow-up with the doctor and early detection if there's any recurrence. For example, if there's any abnormal bleeding, abdominal pain, to report early. Yeah.
Okay, thank you. So another question from Chantal. So any discomfort or side effects after taking Gardasil 9?
So I would say that the side effects are quite similar and minor compared to many other vaccines that we have all been taking all this while, influenza, COVID, etc. So basically, you just get some mild aches, headaches, fevers, but these are usually transient. Some people don't get anything much except for some mild aches. But in general, there isn't any strong association with any severe adverse effects known so far.
Okay. And will using Stelicept antiseptic wash daily weakens our immunity?
So not that I know of. I'm not familiar with this particular brand or so, but in general, what weakens our immunity are things like smoking, taking medication for certain conditions like, for example, you have an organ transplant like kidney transplant, liver transplant patient, or autoimmune diseases like lupus, rheumatoid arthritis, etc. So using antiseptic wash in general clears the bacteria, etc. in your oral cavity, so that doesn't weaken your immunity. Yeah.
Okay, thank you. I've seemed to miss a few other questions from Chantal above. I'm just going to read them out, okay, while we wait for some other questions, all right? So if I'm 44 years old plus, is the vaccine effective? Does it mean that I could only take one vaccine, and how long could it protect?
Yeah, okay. So so she's aware that, we recommend Gardasil 9 up to 45 years old, not in the other two. So the reason is because the evidence is basically in the Gardasil 9. So with lack of evidence, sometimes it doesn't mean that it is not effective in the other two. But generally, I would also recommend Gardasil 9 because it has the widest coverage. Usually at the age of 40 plus, usually sometimes with exposure to certain HPV, it will not be effective against what you already have in your body. So it will only prevent the other viruses that you've never gotten. So Gardasil 9 actually affords the largest coverage, so the most likely to give you some form of benefit. Yeah, so I would recommend Gardasil 9, and it for all vaccines is actually lifelong protection. There's actually no evidence for need of a booster vaccine. There are evidence that are 7-10 years after to show that quite strong antibody levels as well. Yeah.
Okay, thank you, Dr. Lim. All right, this one is also something that I missed earlier on. All right, I think it's a similar question in the same direction, because she was asking about 44 years old, but the previous question was, if she is 45, does it mean that she can only take one vaccine, and for how long can it protect, and what happened beyond 45? I think that's the most the crux of the question. What happens beyond 45?
Okay, so beyond 45 years old, basically, there is no formal recommendation. As I mentioned, it's basically due to the lack of evidence in the age group. But in general, to summarize what I said, basically, it just means that yeah, it can be taken, but there is a likelihood that the effectiveness may be reduced compared to those below 45 years old. And generally, we make recommendations based on evidence and studies. So with the lack of studies, hence there isn't a formal recommendation for above 45-year-old population, not to say that they cannot have it. If they want to have it, they can, just that the efficiency is not known and likely lower.
All right. Thank you, Dr. Lim. And okay, we do have some other questions. Okay. So this one coming from another member. All right. Should I do ultrasound for screening of ovarian cancer every year?
Yeah, okay, so good question. As I mentioned earlier in the slides, so there's actually no formal screening program for ovarian or womb cancer. So when you do ultrasound, I believe you want to screen for ovarian cancer. So there has been studies to in general population, those who are not at high risk of ovarian cancer, that doing ultrasound basically does not decrease, your risk of cancer death from ovarian cancer, and does not increase the risk of detection. The reason is because they may show you may get a normal scan 1 year, and then 6 months later you start having pain, and then you find that there's actually something there. Scan again. So essentially, this can develop without you knowing in the intervals. So the scans are not. As a result, the scan is not 100% foolproof, and scanning yearly is not shown to be better than if you have any symptoms, you see a doctor and we detect it at that time. So that actually isn't so it's actually not recommended or advised to do yearly ultrasound for ovarian cancer screening, but the exception will be made for women who may have genetic conditions, just like in womb cancer as well. If there is a proven genetic condition for ovarian cancer in a particular individual, then we will recommend screening, and we will also talk to you about preventive surgery of the ovaries also. Yeah.
All right. Thank you, Dr. Lim. Okay. Let me see if we have more questions. All right. We do have one from Swan again. All right. So for young ladies, moms, you have mentioned they need to have pap smear while 25 to 29, and HPV test happens once 3 years beyond 30. Is HPV test widely offered in clinics nowadays?
Okay, so between 25 to 29 years old, the cervical cancer screening method recommended is pap smear every 3 years, and then between 30 to 69 years old is HPV test, actually every 5 years, because it is a more sensitive and accurate test compared to pap smear. So that's for the first part of the question. HPV test is actually now available in all the polyclinics and in the public hospitals as well. So this has been the case since April 2019, since we went from pap smear to HPV test. Yeah.
Okay, thanks, Dr. Lim. We hope you answered your question. All right, we have one more. This seems to be an interesting question. All right, so can a pre-existing ovarian and womb cancer person still take vaccine and still be effective? If yes, what should be taken?
Okay, so right now you are talking about different organ systems. So essentially, if you have ovarian and endometrial cancer, so it depends. So basically, the short answer is that yes, you still can take the vaccination, because I believe you're talking about the vaccination for cervical cancer, because you're actually preventing another organ system, cervical cancer basically. The longer answer is that in immunosuppressed population, which means that patients who have their immunity suppressed, whether by cancer or by cancer treatment like chemotherapy, sometimes the immunity that they mount to the vaccination may be poorer compared to the general population. So the efficiency may be reduced when you take it in that situation. Yeah.
All right, thank you, Dr. Lim. I think we have about time for one more question or two. All right, so depending. So I have one over here. All right, so if my daughter has completed her HPV vaccination at 10 years old, when does she need to start her cervical cancer screening?
Okay, so the cervical cancer screening should start at 25 years old, as long as the girl or lady is sexually active ever. If she still is not sexually active at that point in time ever, then whenever sexual intercourse starts at whichever age. Yeah.
All right, thank you, Dr. Lim. Okay,
Yeah.
one more. All right, so if I have taken the Cervix vaccine before, do you recommend that I take the Gardasil 9 vaccine now?
Okay, so this brings back to the other question also of previously vaccinated individuals, whether to take the Gardasil 9. So basically, as I mentioned, we don't strongly recommend the need to, because the increase is about 20% coverage of cervical cancer coverage, and also of the cost associated. But if the patient wants to, certainly they can, knowing the associated costs. But bearing in mind that whether they take the additional vaccination or not, cervical cancer screening should still be commenced as per usual.
Okay, if I think we have for one more question, maybe a short one. All right, so from Chantal again. So for patient who just had breast cancer a few months ago and take the Gardasil 9, the daily usage of antiseptic wash I referred to earlier was used in the private part. Will this weaken our natural defense?
Okay, so for patients with recent cancer history, I would recommend that. I would recommend that before you take any new medication vaccination, speak to your cancer specialist in charge as well. And in terms of wash, feminine wash, in the private parts, in general, we do not recommend that in all of our patients, because that actually does deplete our natural microbial environment. It can cause symptoms, in fact, of itch and discharge. So if in that sense, we do not actually recommend people to use feminine wash. Usually, we'll just tell our patients that just use clear water, keep it dry, and that's enough.
Okay, so thank you so much, Dr. Lim, for answering all our questions today, and for wonderful sharing today. And thank you everyone for taking the time to be here to ask all these questions. We hope that we will have the pleasure to invite Dr. Lim again to come and share with us her vast experience. All right. So before we end tonight's talk, I would like to share a little bit more about next month's Facebook Live. All right, so it will be in Mandarin. Okay, so the topic will be 谈谈肺癌诊断与治疗新进展. Okay, so the doctor's name is Liang Shuangshang Yishen. Okay, so the date will be on the 17th of July. Same is on a Saturday at 8 p.m. So do keep a lookout for this event, and I hope you can sign up and then attend this as well. All right, so please follow us on our social media pages as well, as mentioned earlier. All right, it will really help us a lot, and of course our co-organizers as well. Okay, so right before we end, this is a QR code to maybe you can share a little feedback with us today on how well we did today, so we can continue to better ourselves to serve our members better. Okay, I'm just gonna leave it here for a few seconds. Okay, I hope that everyone's enjoyed tonight's talk. Have a great weekend ahead. Good night.